my name is Raylan and this is my COVID-19 story. Today is my birthday and I made this COVID-19 awareness just to share to you guys my experience, my symptoms, the treatments and medication I took, what are the medical emergencies I have to watch out for, and what other extra things I do for myself to get over this viral infection. But before that, I want to give to you guys some of my history. I'm 24 years old. I considered myself healthy before getting this virus. My vitals been within normal range and stable. I don't have, or I was never diagnosed with any disease. I don't smoke, I don't drink, and I don't really hardly take medication unless I really have to. So now let's talk about symptoms. So I was having this bad headache. That's the first thing I got. After coming off of work on the 26th, I was not feeling that great. I thought I was just too exhausted after working a couple nights in a row. I did went home, do my routine, got my shower, afternoon comes and I was exhausted. I was like ready for bed. I slept and I did not woke up until it was like 12 a.m. that night. I slept for 12 hours straight. I woke up and I feel so warm. I do had a fever. I did check my temperature and it was 107 orally. I did took the Tylenol. My fever subside. My headache comes and go. It was a sore throat, headache, runny nose, cough, body aches. I had a fever. I lost my sense of smell and taste, and I feel so tired. I was just tired all the time. Even I don't do anything, and for some reason I feel a little dizzy. So how do I confirm that I was positive? On the 27th, I went to Medical Express, and before I went over there, I called them. I told them I have a symptoms of COVID. I was exposed with COVID patients. And I told them that I wanted an antigen test or the rapid test, also PCR, also a flu swab. And I told them I don't want to get other people to get infected. So they made me wait on the parking lot, and of course, whenever they have the room ready for me, I went in over there. Trying to be a good girl. Just kidding. No, I'm afraid to infect other people because it's so hard to be sick. So they did they swabbed me. They did the antigen, and it's not even 15 minutes. And it shows I'm positive. And I was like, okay, this is well expected. You're a nurse. You are taking care of COVID patients. Even though I was wearing the whole PPE, I still got infected. I did take a deep breath, because I was still a little nervous. Now I'm COVID positive. I have no family here in US. Just my son, my 4-year-old son. And my parents are so far away. They're all the way back in the Philippines. So the doctor came in and we talked about, the treatments and medication that I have to take. Since my COVID is manageable and I'm not on any distress or I'm not having trouble breathing or none of medical emergencies, how we're gonna treat my COVID is we're gonna treat the symptoms. So I need medications, right? So to treat my fever and my headache and my body aches, I can just take Tylenol, Motrin or Aleve, and I can get it like over-the-counter drugs. I don't need prescription for that. Then, because I have this cough and cold, I can take some guaifenesin. Also, that one, I don't need some, it's an over-the-counter drug, so I can just get it like even in Dollar General or Walmart. But since I'm infected, I shouldn't be going anywhere. Luckily, I do have that at home already. If you are positive with COVID, please stay home, be quarantined. So I'm being quarantined in my house. In my house, yes, until January 4th. Next, I'm about to tell you guys what are the medical emergencies that you should pay attention, or this is very important. First of all, if you are having trouble breathing or short of breath. 2, watch out for the bluish color on your lips or your face. It means you're not getting enough oxygen. Number 3, mental status. So a change of mental status. If you're getting more confused, you couldn't stay alert and awake. This one last thing is also important. If you have a child that is positive for COVID and their temperature is not subsiding, even you gave them some antipyretic drugs like Tylenol, and their fever is still 100.4 and above, it is a medical emergency. Please take them right away to the nearest hospital or the ER to get them evaluated and further more treatments. Now, I'm gonna talk to you guys about what other things I do for myself to get over this viral infection. So right now, I do take some vitamins. I do take vitamin C, D, and zinc. I keep myself hydrated. I try to eat warm food. It makes me feel better for some reason. What else I do for? I do check my vital signs every day, just to make sure, I'm okay. And I do check my temperature every 8 hours since I was having enough fever. I do take my medication on time. I make sure I ate 3 meals or I eat on time. It is important, even though I don't taste anything and everything, it tastes bland. I still eat because it's important for you to eat whenever you're sick. I try to eat lots of protein. Protein. Yes, I love chicken, so that's a good thing. Now I'm going to ask you guys to please pray for this pandemic to be over. Also to your family and friends to stay safe and healthy. Also, please pray for all the patients that was infected by COVID. Also, all those medical providers, because lately, like me, my co-nurses are infected by this virus and we have to stay home, be quarantined. So the patient-staff ratio been a little worse. So just please keep praying for everyone. I hope this video kind of give you guys an idea on what to do, what are the symptoms of having COVID. I hope you guys have a happy holiday, stay safe, stay healthy, and I wish you all well. Thank you, bye.